You're watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD.
In the Health Wire, we ask, are there really any dangers between cancer and using cell phones?
I don't know. It's a scary thought because how closely attached are we to our phones? They're
Especially
literally
when you press them right up against your head.
Exactly.
Well,
and what's interesting about this, Ron, is Cheryl said that the brain tumor was in a part of her brain where she would hold the cell phone.
Yeah, so we're going to talk with a doc right now who maybe can shed a little bit of light on it for us. This is Dr. Murali Murty, who is a radiational oncologist here in the Valley, treats about 400 patients every year. What about these reports from Cheryl Crow? I thought for the most part we had managed to, through some of the studies, dismiss most people's fears about cell phone usage and brain cancer.
And that's true for that's true in general, there are studies. There have been many studies that that have been used to evaluate the link between cell phone usage and brain tumors and salivary tumors, salivary gland tumors. We have salivary glands on both sides of our face,
right up in that same area.
That area.
So are you at all suspicious? I mean, the survey, like you said, most of the studies disprove it, but are you suspicious at all?
Yes, I think I would exercise some caution when using cell phones.
Okay.
Most studies don't show a link. However, there are a few studies that possibly show a link, and those public health advocates who are there's certain public health advocates
that really are pushing it. Yeah,
yes,
yeah, absolutely.
are pushing it.
Okay, so maybe best to exercise a little bit of caution if you can go on speakerphone or whatever. You're obviously going to be way better off.
Right, hands-free.
Hands-free.
Yes.
So let me ask you while we have you, since you're an expert in this field, about some of the other types of cancers. You know, prostate cancer and breast cancer are so common, and yet we're seeing some increased success in breast cancer specifically, right?
Yes. You know, in the radiation oncology world, we we're able to reduce the toxicity to the patient by reducing the amount of tissue we radiate, specifically by radiating a specific area in the breast where the tumor used to be. And this is using
with more pinpoint technology.
That's right, using brachytherapy, which is pinpoint radiation, you can say loosely.
And so I'm sure every woman watching, obviously, you know, you always worry about breast cancer. Every guy watching, you worry about prostate cancer. But you were telling me, whether it's prostate cancer or some of the others, there are a few very simple steps that really have been proven to work to eliminate the risk, or not eliminate but reduce.
That's right. So heart healthiness equates to prostate healthiness. Okay. And if you eat well, control your weight, exercise, that contributes to a increase or decreased risk of prostate cancer in general.
Doc, thanks very much for that. Matter of fact, he was telling me, you guys, there's just this link between obesity and cancer that they seem to be finding more and more kind of a symbiotic relationship between them for something in those fat cells. So just another reason to try to either reduce the diet a little bit or maybe spend a little more time exercising. And I like what he said, prostate health or heart health equals prostate health, and it can also help in fighting some of these other cancers.
That's best advice you could get is, do a little more exercise, eat right and get in shape, and
all that.
We could all do that here in this country.
I know, we can.